Alrighty, now we're recording. But that's okay. That was just updates for the live webinar. So we will send out a link for recording for all 3 webinars once those are uploaded. And just in case you all weren't with us at the first webinar last week, I have with me today PsychArmor Institute's Chief Program Officer, Dr. Carrie Rogers, and our subject matter expert, Dr. Jill Borman. Now, before I turn it over to you guys for the presentation, can you just say a few words about yourself to kind of reintroduce you guys to the group?
Sure, Jill, I'll go first since my name's on the top of the slide, and then we'll go down to you so we keep everybody oriented. My name is Carrie Rogers. I'm a clinical psychologist, and I am the Chief Program Officer at PsychArmor. I have been with PsychArmor for about 4.5 years, but before that I worked at the VA, and I was a clinician as well as a researcher and educator at the VA. And one of the best experiences that I had in my 17 years there was working with Dr. Borman, who taught me how to do Mantram and who taught me how to use that tool in my work with the veterans and their family members that I worked with. It's been an invaluable tool. It's been an invaluable personal experience. And we are at PsychArmor super excited to have her working with us to bring that tool to you all for your personal use as well as for your work with the caregivers who you serve. So Jill, I'll let you do a quick introduction.
Yeah, I'm Jill Borman. I'm a psychiatric nurse by background, but I sort of became a research scientist 20 years ago. I had the opportunity to work with vets at the Veteran Hospital and began a program of research on what we call Mantram Repetition Program, which is something that is so easy to do. It's so teeny weeny, you don't think it's even going to have an effect on you. But anyway, I've been at the VA, and then I've also done some other consulting and other research studies, and we have a lot of things related to Mantram if you go online and want to look up some other things. But I'm delighted to be here today.
Great, thank you both. Just for our attendees here today, if you have any questions or technical issues during the presentation, let me know in the chat box, and I'll be monitoring that throughout the presentation. And before we jump into the presentation, I believe we have some polls for everyone to answer. And this is the same slide as the last presentation. Everyone should have received a facilitator's guide, participant manual, and pretest link. If you didn't receive any of those, the guide and manual link is in the chat, and then contact mantram@psycharmor.org to receive the pretest link. Alrighty, so poll questions. So the first one is, did you choose a Mantram after last week's webinar? Second is, did you use your Mantram after last week's webinar? And third, did you share the Mantram resources with at least one military caregiver? And if you didn't, let us know if you shared it with anyone else in the chat box. Alrighty, we're gonna go ahead.
You can see in the chat box. Go ahead. Oh, go ahead for the results. Yeah. Do you have the results?
Yes.
All right. Oh, good. 65% thought it was easy. That's wonderful. And some people couldn't decide, 18% and 18%. That's about normal. That's about right for any kind of newly learning behavioral skill. So those of you that couldn't decide or forgot, you can always do it this week. And did you use your Mantram? I'm thrilled to see 65%. That's awesome. And did you share it? Okay. Some of you did. That's great.
And then one person mentioned in the chat that they shared it with a couple of patients who struggle with anxiety, which is great. That's awesome. And let us know if you shared it with any friends or family. It doesn't have to be with a patient or military caregiver that you work with. It really can apply to anyone.
I love these polls.
They're very insightful for us.
They're great.
And then we just have a quick chat activity. So if you used, if you chose a Mantram, if you shared it with someone, what are some challenges that you all faced over the past week? Or if you've used Mantram in the past, what are some challenges that you've faced?
It's not uncommon to be reluctant to use it. initially.
So somebody's saying pronunciation, that's fair. I'm trying to remember, Jill, the first time I taught it to somebody.
Mm-hmm.
I think they were super skeptical and it tripped me up.
Sure.
I was like, oh, okay, you don't, like, it really threw me. I was so excited about it, I think, and so that was one of the things that I struggled with the first time I tried to help somebody begin to utilize it as a tool.
Yeah. Well, one thing about pronunciation is that sometimes you don't have to worry too much about it, because according to Eknath Eschwaran, it still has an effect upon you. So for example, I see here, not last week, but in the past, with religious concerns. And, we don't want anybody to commit blasphemy. Whatever faith or background a person has, there are mantras for that background. Oh, great. I'm glad they're using it at the base gym. That's a great place to use mantram. But we had a veteran one time, and we were being interviewed up at the VA, and the interviewer came up to this veteran and said, "Hey, what's your mantram?" And he went, "Om Namah Shivaya, Om Namah Shivaya." And she said, "Oh, that sounds really good. What does it mean?" "I don't know. I just like it and it works." Of course, most of us want to know how to pronounce it correctly. Most of us, we're humans, and we have to think, we have to cognitively understand everything. Sometimes mantram is not something that you can really cognitively understand, but rather you can experience. And that's what we're after with this webinar, is to just prompt you to try it out, to experience it.
I'm glad people have used it. Marty is saying you weren't able to attend the first webinar, so you haven't had the opportunity to use it or listen to the recording. The recordings will be up. So we are, one of the blessings of virtual land is that, if you miss something, if people record it and put it up, you can still have the experience. So definitely, if anybody is going to be missing any one of the series, we'll have those available.
I think
I remember when I first started, Jill, too, spending more time as I got used to talking to people about mantram, talking more about what mantram does as much as what mantram is, so that it was helpful for rumination. It was helpful when you're getting distracted. It was helpful to sort of just bring yourself, it really is about attention and controlling your attention.
All about training attention. That's what
it's all
and so
about. When I spent more time talking about that and less time talking about sort of the history of it, some folks who were more worried about that in terms of religion or whatever, really got into like, oh, there's stuff going on in my brain that this is helpful with, and it made it feel much more scientific, and that was helpful for folks.
Another thing you can use is just call it a rapid focus tool. Just call it doesn't have to be a mantram, or it can be your rapid focus word. That's what we're doing, is rapidly focusing on that one word. And that's sometimes a little more palatable to people.
All right, should we move forward?
Yes. We do have another chat. So we just want to get some ideas from our attendees here today about how you all think it could benefit military caregivers that you work with, or if you don't work with military caregivers, just anyone that you work with or live with, and maybe they have anxiety with the holidays coming up. What are some benefits that they might see that we talked about last time, or that you've heard of before?
I think the holidays are going to be big for people. I am already a little bit stressed out about managing that, and being away from people who I was planning to be near and to be helpful and to do some caregiving for. So I think holidays are going to be big. We also have preventing burnout and compassion fatigue. I think burnout and compassion fatigue, I don't know what you think, Jill, but it gets worse around the holidays anyway. And we are in such a weird, stressful time that I feel like it's compounded. I don't know if Jill, if that's something that you think you're seeing in providers, but I think it's huge.
Well, it is huge. With this pandemic, it's given us a whole nother layer of stress. And I want to talk about this later, but talk about how we ruminate on the past. Oh, I wish we were pre-COVID.
Mm-hmm.
And then we fear for the future. Oh, what if?
Mm-hmm.
So we'll talk a little bit more about that, but Mantrum's a way to help you with that.
Yep. And somebody's talking about taming emotions, for having more control regarding choices about how they respond to stressful situations. I think that's absolutely true. It's a pause. Jill, you talk about this as a pause button. And I think for emotion, that's a big, big deal to be able to go, oh, it's going to take a second. It can really be helpful. Yep.
We like to use the analogy. We like to use the analogy of going from automatic pilot to manual, so that in our minds we're automatic. Everything's so fast. But if we can shift down and slow down and have that pause time, then we can make those decisions. All right, Carrie.
Caring during a pandemic. So this is some of the stuff that we had thought about in terms of working with some military caregivers, some of the things that we did some research and also looked at research that's been done, and kind of pulled up what do military caregivers talk about in terms of being stressed, and what are people talking about in terms of pandemic stress. And oh my gosh, there's an incredible overlap. So we have this population, and you guys all know this because you work with military caregivers who are more stressed than the general population generally. And caregiving can be, while incredibly meaningful and fulfilling, also stressful and challenging. So there's, the juggling of doctor's appointments and housekeeping and errands with caregiving activities. There's often a lot of grief and loss that comes with caregiving, potentially grieving the loss of the relationship that you may have had, or another person's abilities, what you had imagined your life might be if you're caregiving for somebody who's injured, who may have had some changes that are going to impact you in a big way. Caregivers often lose income as they shift to caregiving, especially if they're full-time caregivers, and that can lead to problems with food insecurity. Social isolation and health issues are big with caregivers, family caregivers, generally. So those are things that are already in the mix with military caregivers. And then you add this pandemic-related stress where, unique to the pandemic, but is adding to it is the online doctor's appointments, the online school. Respite is challenging right now. People who may have had opportunities to have somebody come into their homes for respite may not have that as much anymore. And so we want to just encourage you to think about, and I'm sure you're seeing it all the time, that military caregivers are kind of dealing with both of these stress packages, and the overlap is really hard. So as we think about Mantram, certainly as I think about Mantram, it really is a tool that can be incredibly effective. We have the research to show that it can be incredibly effective in high stress, long-term stressful situations, and with psychiatric illnesses that are more chronic than acute. It's not that hard to implement. It takes discipline, but you don't have to have 27 forms and the right colored pencils and a notebook or any of that kind of stuff, right? So it can be really simple go-to thing. So I think that's just one of the things as you think about working with caregivers during the holidays and during the pandemic, there's a whole bunch of things going on for them that makes us really kind of want to give them more tools. And I don't know, Jill, if you had anything else you wanted to add to that.
No, I want to go on, and
okay.
I want to, because we're going to cover some of this, but there might be some people on the call that weren't in the first session, and I just want to clarify, Mantram is a word that means to cross the mind. Manas and Tri, Mantram. It's a word to cross the mind, and we usually choose a spiritual word or phrase that has an effect upon us. And sometimes if you're going to teach this to another person, you might have to preface it by saying, you know, you might be really skeptical. You might think this sounds kind of strange, but we want you to choose this word, this phrase, and just repeat it as much as you can. Now, for example, Mahatma Gandhi's mantra was Rama. So I may use Rama, Rama. It means joy within, to talk about the rest of the things today. But I want to talk first about slowing down, which is a foreign concept in our society. You know, we've gone from writing longhand to typewriters and now texting. Everything is speeded up. You cannot help but be speeded up in this world with this technology. Similarly, remember back in the day when you went to cook something, you'd actually cook it on the stove. You might even actually bake it in the oven. Then we got pressure cookers. Now we have Instapots. And then we also have microwaves. So in these kinds of situations, our society around us is speeding us up with time-saving things that we end up filling up our time with other stuff. But the other way mantra helps to slow down is it interrupts the rumination, as Carrie said. Repeating Rama, 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 it interrupts whatever that rumination is going through your head. And it helps you to become one-pointed. And so these three strategies that we'll be talking about, mantra, slowing down, one-pointed attention, all three give you an opportunity to interrupt whatever stream of thought you have going so that you can step back for a moment, raise awareness, and then hopefully make a more, shall we say, thoughtful, intentional response. Then there's also one-pointed attention, which is being single-focused. And one-pointed attention is a fabulous tool for any of us who have a lot to do and we want to get things done. And we don't want to be interrupted, or we often are interrupted. But there's two ways you can focus your attention. One is internally on your mind. Like I said, you're walking around, you can just say Rama, 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 and you can interrupt your thoughts. Helps you concentrate on that, and you can do it anywhere. Or you can take that same concentration and externally focus on any task at hand. And so, you know, if you think about an elephant, and I wanted this picture in here because you can see an elephant with a trunk and it's going down the market of life and it's picking up this and it's picking up that and it's grabbing at everything. Well, that's like our minds. Our minds get distracted and scattered and they go here and they go there and they go everywhere. So what does the owner of the elephant do? He gives them a stick to hold on to. And so in a sense, your mantra is a stick for the mind. It gives you something to hold on to, focus on, and carry with you. So there's lots of ways to practice one-pointed attention. And this holiday season, you will have numerous ways to practice one-pointed attention. And, you know, when you're talking to a friend or talking to a family member, really focus in on them. Give them your full undivided attention. I've been a master at interrupting other people's sentences. So just by holding back, letting the person finish and talk, that's another way to practice one-pointed attention. Right now, I know many of you that are on this Zoom line, I'm sure that you have a zillion other things you want to be doing, and you may not be practicing one-pointed attention right now. So I'm going to ask you and invite you to kind of put aside your text phone, your smartphone, put aside your list of things to do or whatever, and try to bring your full attention right here, right now, to this webinar. And that's going to save you some energy. You may not notice it right away, but when we switch from one thing to another, we're using up energy, the energy it takes for your mind to change tasks. And there's always a residual in that switch. So let's see. So oftentimes, if we do one thing at a time, we will make fewer mistakes as well. Okay, next slide. So during a pandemic, as we've talked about, we're juggling many different priorities and we have busy schedules and we're going to make more mistakes. and fears and uncertainty about the future. I think this is a really powerful tool when you find yourself ruminating really about anything, especially if you're ruminating about something you have no control over. Like right now, we have no control over what the vaccine is going to do or what's happening with the pandemic. We don't really have control over that right now in the present moment. So now's the time, if you use your mantra, you bring yourself into the present moment. And like another thing, I think many of us are thinking, I know I did this morning, I thought, the good old days, how long ago has it been? The good old days, didn't have to wear a mask, didn't have to be so worried about everything. And so by using mantra repetition, you're setting up the relaxation response. And that can be useful in all these different situations. Next one. So Zoom fatigue, this is my favorite. I did a lot of Zoom. I don't know about you, but I've had it, continue to have it. Because all we're doing is we're sitting in front of our laptops, Zooming. And I found several tips. And one of them is that if you can see yourself on the screen and that's distracting to you, like you're looking at your hair, you're looking at whatever, is to put a little sticky note over your camera. The other thing is to make a decision that being on a Zoom meeting is a one-pointed attention project. And we're going to talk about that later in the session, but you have to make yourself decide, this is going to be my one-pointed attention project, and I'm going to see if I can really do this. Can I really sit here through this webinar and maintain my full attention all the time? The other thing is that when you begin to find your mind wandering, that's, use your mantra to bring you back. And it takes time to do this and practice. But these are ways that can help you with your Zoom fatigue. Because what makes it fatigue is switching attention. That's partially why you get so tired. You're switching attention and you have only this one little box to look at. So you're not in a room with people where you can see their bodies and their faces. So in any case, those are some tips for Zoom fatigue. And then hurry sickness. Hurry sickness and time pressure is a killer. It is a health, it is like a disease, really. Hurry sickness is when you're always in a hurry and you never get a downtime, you never get a break. And you can see sometimes if you are in a hurry, you're going to frequently interrupt others. You might find yourself speeding on the highway, which is easy to do in California, I think. You might find yourself eating quickly and not thinking clearly about what I really should eat, what are some healthy choices. And when you're totally wiped out, slowing down is going to help you in dealing with all these other stressors. And we call it hurry sickness, or I think of time pressure. Time pressure alone is anxiety. Whenever I'm in a hurry and I got to get there, my cortisol and my, stress hormones are flying out the window. So there's ways we can deal with that. Let's go to the next slide. So some ways to slow down. As I said earlier, mantra is like a pause button. And as soon as you repeat your mantra, you have to interrupt what's going on in your head. We always talk about the monkey mind and how the monkey mind is jumping here and everything. But if you repeat your mantra, it kind of brings you to the center to focus on the next thing you want to focus on. So one way to slow down, and some of you might say, oh, there's no way I can do this, but just try it, is to go to bed 15 minutes earlier and get up 15 minutes earlier. Sometimes just an extra 15 minutes in the morning is just amazing what it can do for the rest of your day. Of course, if you have too much to do, it's hard to slow down, right? So you have to really look at what's essential. What is the most important thing that has to be done today? And of course, we all know we got to learn to say no. As a nurse, someone who often, is not easy to say no to people, but we need to learn to set limits. Allow yourself time early. That's another thing about Zoom fatigue, is get to your meetings early. There were 6 people online, at least 5 or 10 minutes. Bravo to you guys for logging in early. And when slowing down, it gives you that pause so that you can make a better decision. All right, next slide.
And Jill, I would just say real quickly, as I think about working with a caregiver who's feeling really overwhelmed and is going to maybe go, I couldn't possibly do that. I couldn't possibly do that. One of the things that I think is so useful about Montrum is that this is a tool that actually helps you implement all of those activities, right? So you can do the Montrum while you're, prepping for that stuff. It's super easy to implement. And that can be really helpful when you're working with folks who are feeling overwhelmed. We certainly don't want to say, well, just go ahead and try to be early. So the Montrum, practicing the Montrum really helps you to sort of build that tool, that muscle up so that you can implement it, right?
That's really right.
We don't talk about, why don't you just go run a marathon? That would be awesome. No. Why don't you walk around the block a couple times, right? And build your strength up. So I think that that's a really nice thing about Montrum, is that you can start implementing it immediately and implement it and build that up.
Yeah,
right?
You hit the nail on the head, Carrie, because when some people, when they hear slowing down, they freak out. I can't slow down. I can't get everything done, and they freak out. But we're not necessarily always talking about moving through space. We're not talking about, slow down your walking. We're talking about slowing down the speed of your mind. And that is what you're talking about when you can do it anytime and anywhere. It gives yourself a tiny little break. We call it a jacuzzi for the mind.
Yeah.
Just cut out for a few seconds, repeat your mantra, Rama, 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 Rama. And that can help some of that stress.
Yeah, even for me, center yourself before you do something. I don't even know what that looks like. But then I started doing, say your mantra 5 times before you start the Zoom call. That's a thing that I can do. It's really, constrained. It's 5 times. It's my mantra. I put my behind in the chair. I say my mantra 5 times, and then I click the button. That is really actionable, right?
Absolutely.
And it's not okay, I've just got to be a different mindful person as I sit here. I don't even know how to do that. So this, for me, Montrum is a really actionable thing to implement. So I would just encourage you to think about that as you're working with folks.
And then one-pointed attention and projects to kind of practice. A one-pointed attention project, this is great. We're moving into the Thanksgiving holiday. We're moving in to doing a lot of things that aren't usually on our calendar. We're trying to figure out ways we're going to connect with our family without being in person. But choose something that you have been putting off. This is what we always do in our classes. We say, choose something that you've been putting off for, who knows, like a closet. Or we had one veteran, and he had this truck, and it was so full of stuff. And he said, oh, my truck is a mess. And I keep saying I'm going to clean it up, but I don't ever do it. I don't ever do it. So we gave him this one-pointed attention project, which is set the timer for 30 minutes and commit seriously for 30 minutes to do that task. Well, he came back the next week, and he was shocked at how little time it really took him to clean his truck when that's all he was doing. It's when we think we're going to do a project and then we get interrupted and we don't really want to do it anyway, And so the thing is they say to do 2 things is to do neither. So to have your attention split while you're in the middle of trying to accomplish something, you're really not going to be doing your best work. So if you do it in one-pointed attention project, and some of you may or may not be able to set up your environment this way, but the idea, again, is to put aside your phone, figure out what you're going to do, just try for 30 minutes, 15 minutes, doesn't matter, however much time you want, and then just give it your full undivided attention, and you might be surprised that it wasn't as awful, because oftentimes we resist, and what we resist persists. The other thing about mantram is just using it to raise your awareness. How speeded up am I? So we should be able to repeat mantram when you've noticed your heads, you think about too many things and you can't keep things straight. Those are the best times to repeat mantram. Okay. What does hurry sickness look like in your work and personal life right now? This is in the chat box. And Carrie, are you going to read those or should I read some?
Either. I mean, we can both do it. I will tell you all of the screen stuff. You're right. I mean, I'm sitting here listening to you talking about Zoom and hurry sickness. Like when I'm in a meeting, and this is like probably a really bad thing, but I have 3 screens now.
Oh my goodness.
I thought was super cool in the beginning, and I'm starting to realize that it's kind of causing some hurry sickness because I literally can put up my email, my Slack channel, my calendar, my Zoom meeting that I'm in, and notes and other things that I need to be doing. I've actually facilitated a hurry sickness a little bit by having all of these screens that I can look at. That's kind of what it's starting to look like for me. And I am going to be doing some rethinking about that. I didn't used to do that before, before I was on Zoom all the time. You know, when my life was less virtual, I would get up and check in with somebody around coffee or whatever. And now I've kind of set up this electronic, and I have a phone next to me. I have 4 screens. So I've set up this kind of electronic, like, I don't know, over busyness or something, this push to kind of have all this information at the same time. And it's probably really not healthy.
Well, I've looked into the literature, Carrie. I've looked into the literature about being one-pointed, and there's something called switch time.
Yep.
The time it takes you to go from one to the other, and there's also residual. I'd never heard this before, but there's a residual. So as you're, trying to leave one task, your mind is still trying to wrap that task up so it can move forward and not be dragged behind. So there's sort of a residual energy that's being pulled on your system is the way I think of it. Yeah.
Yeah, that whole idea of multitasking, cognitive psychologists would tell us that that's not really what you're doing. You're not doing multiple things at once. You're switching, you're task shifting, and there's a cost, which is what you're talking about. So we've got a couple chats. Impatience with career plans, currently getting to all the clients that are in need of mental health treatment right now. I think for providers, for people who are working with other folks, and you guys are working with military caregivers, and we just talked about how much is going on for those folks. There definitely is a pressure to get to everybody perfectly all the time and alleviate all of that. And it can really cause some hurry sickness in the life of providers, I think. I think we're seeing some more burnout in providers, first responders for sure, but also I think mental health providers. Yeah. And we're also having people say, I'm interrupted, or there are spontaneous urgent tasks. Yeah. Things that come up during the day that you hadn't planned, they pop up and it makes you feel like, oh, I have to get to those right now. I don't know about other folks, but working at home, while it's come with some real blessings, has also come with some real challenges, because all that laundry and sweeping the floor and all that stuff is sitting right there. And it makes me feel like it's a cue, like, oh, look, there's something else I need to get to. Before, when I was in an office, I couldn't do my laundry, so I kind of let that go. And now I'm sitting in a home office and there's laundry in the next door room that I'm feeling anxious about, like I need to get it done now. So I don't know, are other people having that kind of stuff as you're working at home?
Yeah, to the person who says, I feel the hurry sickness when I'm interrupted, or I have to do spontaneous, urgent tasks. We used to talk about this a lot in our healthcare providers who were taking mantram classes. And we knew if you're a nurse and you're taking care of a patient and you got to hang the IV and you got to take the temperature and you got to move from thing to thing, you can't just set a timer and wait for 30 minutes to take care of your patient, right? So that's not very practical. But what is practical is after using Mantram and getting used to focusing your attention, you can do those tasks and switch from one to another with focused attention. You know, bringing your full attention to, now I'm going to do this task. Okay. Now I'm going to do this task. Okay. And just like that, just one at a time. And that can help once you've really gotten this idea of focused attention and training your attention. You can use that even if you are in a hurry and you want to do something, but do it with full undivided attention.
Jill, can I ask you a question about that?
Yeah.
How would you, for beginners, which I still kind of think of myself as, even though I've been doing Mantram for a while, I still not necessarily in that later stage of my Mantram practice. How would you recommend using the Mantram between tasks, or just find that using the Mantram, if you even just set aside a few minutes beginning and end of the day, or for me before I sit down on a webinar, that those things, that those pieces of time will help you build that muscle, so that you don't necessarily need to do it between every task. It's just that doing it strengthens that for when you are doing some shifting.
Well, you're absolutely right, Carrie, you're right. And Ashwaran and the whole concept of this program is that if you think of your mind as a computer, and your mind has to do stuff all the time, and I'm going from one task to another, and as soon as I don't use my mind for something like decision making or thinking or planning or problem solving, I could be reverting to my Mantram like a screensaver. I often think the Mantram is a screensaver for the mind. So even in those snippets of time, like you were saying, that you can repeat your Mantram, think of it as a respite. Think of it as a little solace, a little place you can go with your Rama, 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 and you can just kind of quiet down and then go to the next thing. So it's really, that's how it's a good pause button, and doing it between things, as long as you don't need to problem solve, in between, plan what you're going to do, but to bring you into the present moment and just take a couple of times, Rama, 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 and be done. We've had healthcare providers in their clinics who use Mantram all the time, and this one doctor, he has it so tuned in, it's so triggered for him that every time he walks to see the next patient and he reaches for the doorknob, he says his Mantram.
Wow. So
looking at the doorknob was his cue. Okay, time to say Mantram.
I love that.
Yeah, and for those of you well, for all of us really, but in caregivers and military caregivers, we need to make this practice happen. You've got to remind yourself, and it'll come easier if we tie it to certain things. Every time you open a doorknob, or somebody used to say, every time I looked at my watch, I'd say my Mantram, or things like that. That can be helpful.
So for this, maybe if you're seeing caregivers, you're supporting caregivers, and some of that's virtual, maybe every time you open the next window for the next caregiver or something like that. Then you might be able to work with caregivers on what they're doing consistently, and it may be caregiving activities that they can do their Mantram during or before.
All right, we got another chat.
So hurry sickness, what does it look like in the people who you're taking care of, everybody? The military caregivers that you are taking care of, what are you seeing that as we're talking about hurry sickness and time pressure, are any of you going, oh, wait, I'm seeing that in the caregivers I work with, and this is what it's looking like? I'm guessing, my mother is a caregiver, and so I sort of do some virtual caregiving, and figuring out juggling virtual doctor's appointments has been a real challenge. And it has to be right, and it has to be perfect, and I have to figure it out right at this moment. That has created this pressure to get good at technology in a way that my 73-year-old mother may not have ever wanted or needed or be wired for or whatever. She now feels like she's got to get some, figure out how to do her computer better, figure out how to do all this stuff. And it really is, it's creating a lot of stress for her. And it's hurry sickness. It's like, I got to do this now or I won't be able to take care of that doctor's appointment. So I got to get really literate in computers. So I see that for sure. So I would just say, I would encourage you all to be paying attention to as you're working with caregivers who probably are way overburdened right now. How is this manifesting?
Absolutely.
And on the next couple slides, we'll go more into, or we'll touch on slowing down again. And then on the slide after that, we will offer some resources that help caregivers or could help caregivers in slowing down and providing respite and different things, especially around the holidays. And if you have any questions that are coming up for our presenters, feel free to pop them into the Q&A. And then in the last 10 minutes, we'll get into a larger Q&A that everyone can ask questions in.
So do you want to just go to the next slide? There you go, yeah.
There we go. So to get started, and Eshwin used to call this the red pencil test. So take a piece of paper, write down everything, all your responsibilities, go through the list, and is there anything that you can cross out, anything that's not absolute priority? Now that might be very hard if you're a military caregiver. There might not be anything you can cross out. But sometimes we over expect of ourselves what we can do. In other words, we need to be realistic about how much we can do in a day. In fact, we may need to add an extra 15, 20 minutes to every one of our tasks that we didn't count on, and that's probably more realistic, right? It's important to recognize this hurry sickness concept, eating too fast, moving too fast, going from one thing to another. And that's why we say go earlier to bed, drive a little slower, use the mantra to stay in the present moment. And if you notice you're speeding up, that's a really good time to repeat your mantra.
And Jill, I would say that in and of itself has taken a lot of time for me.
Yeah.
So even be aware that I'm speeding up.
I know, we actually have people have made little questionnaires about, what do they call it, hurry sickness, or I forget. There was another name for a questionnaire about, how speeded up are you? And it's divided into 3 categories. And the top category is you need some help. You're gonna burn out. You're gonna, have hypertension. And so these things are really important. All right. Do you want to cover these? Carrie or Jenna?
Jenna, do you want to do, I'm responding to a chat real quick, but do you want to take it, yeah.
Yeah, so the first column here, or overall, these are resources to help military and veteran caregivers that you may work with or that may live in your community. The first one is encourage asking for help and seeking respite. So the Elizabeth Dole Foundation, their Hidden Heroes program, they just launched a respite relief program, and they're expanding it nationwide. If they haven't already, they will be over the next couple months. But that basically matches them with a home health care provider or someone else in their community that can take over some responsibilities that they would normally be responsible for in their life. So that's a new program from the Elizabeth Dole Foundation for military caregivers. And then Operation Family Caregiver is a program that offers short-term, goal-focused counseling to help caregivers and the military members or veterans that they're caring for work through issues that may come up, and can just help them work through challenges that they're facing, especially through COVID. It's all done virtually, so it's a great option really for anyone living anywhere in the US that's caring for a military member or veteran. Another thing that might be helpful is helping them to reflect and prioritize their responsibilities. So some questions that you could ask is, in what areas of life are you currently spending the most time and energy? And what areas of your life would you like to be spending the most time and energy?
And Jenna, one thing I would just add to that, and where I see Montrum kind of coming in again, I think those are amazing questions, and I often have seen, and I've done this to people myself, but I've also had it as when I work clinically with people, I've had people say, well, it doesn't matter what I want because I have to do all of this stuff and I have to do it now, and I have no choices about how I spend my time. And I really love Montrum because it really can be repeat your Montrum 5 times in this moment, right? It can really be like a 5 to 10 second intervention that you do a few times a day that we really see good outcomes with. So that can be kind of included in this idea of helping people reflect and prioritize, so that you're not necessarily telling them that they just have all sorts of choices about what they can do and when they do it, and if they're feeling overwhelmed, they must not be prioritizing things correctly. That's not the message at all. It's really more about, like, is there 5 seconds here and there that you can take out, or while you're helping get the person that you're caring for into the bathroom, while you're changing the sheets, can you do your mantra? And that really does help build this attention thing. So it's this lovely, free, easy tool that people can do during the course of their day to just free their mind up a little bit. So anyway, sorry, Jenna, but I was just thinking about how I've done this with people before and how I've talked about it.
Yeah, thank you for adding that, Carrie. Another thing that caregivers might be able to do to help them slow down a little bit is to connect with peers for accountability in their Montrum practice. The Red Cross Military and Veteran Caregiver Network and the Elizabeth Dole Foundation Hidden Heroes Community are both 2 awesome communities for military caregivers to connect with other caregivers, share resources, and these are both places where they could connect with other caregivers to kind of find a buddy to do their Montrum practice with and reflect on how their individual Montrum practices are going. In the first webinar, Jill talked about how Montrum isn't a group practice. It really is an individual practice that you can do at any time where it's safe, but it could help a caregiver to have that accountability in someone that knows really exactly what they're going through.
Jill, I would love to have you spend a little bit of time talking about the research, because I mean, I'm a big fan of research, so I may be a little bit nerdier than a lot of people in that way, but I do think that it's incredibly, the body of literature that we have about this, much of which you have built, is impressive, and it is convincing. And so it could be useful to talk about.
Yeah, I think one of the most important things about Montrum, and in our research, we have shown how applicable it is to a whole variety of populations. For example, we had homeless women in downtown San Diego, and we came in, and in 1 hour, we all talked about Montrum. We gave them a Montrum. We told them to use it to help them get to sleep at night. That was the primary outcome. And we were able to come back in a week, and we had a statistically significant improvement, even though that was a very small group, maybe only 25 people. But, these women got something out of it in that little bit of time. We've done studies, quite a few, in post-traumatic stress disorder. And I just want to say a funny little story, or actually it was the story that got me into studying PTSD. Because I'm at the VA, we're teaching a Montrum group, got all these vets in there. We got a couple of probably World War vets or Korean vets, and we're teaching Montrum. And we come back after the first or second week, and some guy raises his hand and he says, I have PTSD, and since I've been using this Montrum, I haven't had any PTSD dreams anymore. Well, that's a little far out. I couldn't say that I could say Montrum's going to get rid of your dreams, but by his saying that is what shifted my whole focus into PTSD. And then later, that was around the time of Iraq and so forth. The Iraqi and Afghani wars that came about, and there was funding to do that. So the kinds of things that Montrum can help with, the kinds of outcomes when you look at research, is it definitely helps with stress, your garden variety stress and anxiety. It helps with insomnia. In our veterans, it helps with hyperarousal, those that have PTSD. Now think about it, most of us are in hyperarousal too. Maybe not to the extent of a veteran that has PTSD, but we're living in this era of hyper movement and everything. So it works with that. And I'm trying to think if there's other studies. Other outcomes have been improved quality of life, improved coping, and improved positive coping appraisal, and some improvements in what we call spiritual well-being. Things about meaning and peace and finding comfort in those kind of things. So those are the kind of things.
And in caregivers too, right? Did you find a decrease in caregiver burden, perceived burden in caregivers?
Yes, we did this. Yes, we did. And thank you, Carrie, for reminding me.
Yeah, no, that's fine.
This is about caregivers, but we did a study in family caregivers of veterans with dementia. And in that study, we actually had to revise the study because they couldn't come into the hospital. They had to be with their loved ones, taking care of their loved ones. Right. But nevertheless, we taught them Mantram, and they had improvements in lowering depression. They had improvements in lowering rumination. They had decreases in what's called caregiver burden. And again, it's not a fix-all. It's not something that you're just going to say Mantram a couple of times and boom, all your problems are gone. But it gives you that little tiny tool to just stop for a minute, just pause for a minute, take an assessment of what's happening around you. So yeah, we had positive results in that little study as well.
Mm-hmm. And that was you did it on the phone. You taught people how to do this in short phone.
We did it on the phone. That's right. They came together in the first class. We met face to face. And then for 7 weeks, we just called on the phone every week. We talked about how you're doing, how's it working, how's it going. And that's one thing for you military caregivers, trying to teach other caregivers. This can be done on the phone. And I think the most important thing is to have follow-up. Just like today, I asked how many people chose a mantra and how many forgot. Well, there's always going to be a percentage. We had 18% that forgot. And that's typical. That's common. We all need to be reminded. So I think from that standpoint, teaching it on the phone is great, actually. Well, in answer to this question, I would say all the things we've been talking about can be tools to cope with holiday stress, because holiday stress is just another layer of your garden variety stress with a few extra pandemic issues kind of flown in there. But just to practice, that's all I can say is practice repeating Mantram. You can do it any place. You can do it at any time. You can do it for 3 or 4 times, or you can do it longer. Some people may want to sit quietly and repeat it, but that's not required. We have found improvements without that kind of practice. Okay.
Yay, our next session.
Yeah, we're at the end of our session for today. If anyone has any questions for the presenters, feel free to put them in the Q&A box now, and we'll get to those. The next session will be in 2 weeks on December 7th, 11 a.m. Pacific Standard Time, 2 p.m. Eastern, and it'll be focused on putting all of these tools that we've learned about the past 2 sessions together and really focusing on military caregivers and how Mantram can really benefit them in your work moving forward.
And for folks if you have questions, comments, thoughts, you're trying to use your Mantram and it's been hard and you have something that you want to check in about, send us an email at mantram@psycharmor.org. One of us can get back to you. Probably Jill, because she's better at offering advice.
Well, I'm just looking at some of the chats that we haven't answered, and so that's what I'm saying. Send an email to mantram@psycharmor.org, and I'll get back to you on some of these questions and comments. It's a miracle you're all here this morning. You all get an A+ for being here during the holidays, getting ready for the holidays, and we'll see you in 2 weeks. So you may have some stories to report, and we're happy to hear them.
Absolutely, we're excited to hear them. And Jill is the best Mantram coach there is, so I definitely, while we've got her, feel free to send an email and utilize that resource.
Yep.
Thank you all so much for joining us today. Again, the manual for both you as somebody who will be teaching somebody, as well as the manual for a caregiver who you might be working with on Montrum, are available to you to download. Jenna put the link in the chat. I'm going to guess we can also send it out if we need to, but I think, Jenna, you already did that. So let us know if for some reason you're not able to get that. Keep track of these. Is there a way to buy a printed copy? Maureen, if you have a computer and can download a copy, you are welcome to print it out. If that's a challenge for you, send us an email at montrum@psycharmor.org and we'll see what we can do. They're beautiful facilitators guides. They're beautiful patient manuals. I've used a lot of patient manuals in my day, and these are really user-friendly. So definitely encourage you to take a look at that material between now and December 7th. So you can ask questions and play around with it before our final webinar.
All right, thank you all for joining us.
Bye, everybody. Have a wonderful holiday season if you celebrate.
And I hope you can practice. Don't forget to practice. Put up a sticky note somewhere on your turkey somewhere.
Bye, Jill.
Bye-bye.